Yeah, okay. Okay. So the first question is to Vandana ji, and that specifically address one question, and that is actually in how we live in the world of artificial intelligence, and how cannot what is actually the limitation in using artificial intelligence itself to actually fight against this kind of corporate interventions in the environmental issues? That's one question.
You want me to say it right away? Yeah?
Yeah.
So you can't live in a world of artificial intelligence. Artificial intelligence has nothing to do with living. Artificial intelligence is machine learning. That's all it is. It's just a grand name given to something where elements of a very fragmented part of our thinking, I think Dr. Gangadharan, Dr. Reddy all talked about it as mechanistic reductionist thinking, that this mechanistic reductionist thinking, which is mechanical to begin with, that portion of human thinking can be downloaded into machines. And that set of data can then be processed through algorithms, which are merely instructions of how you add this up into some kind of system. Algorithms are what are called artificial intelligence, but algorithms are not knowledge. They don't know how the system actually works. And they definitely are not about living. They are one-directional instructions. So the other day I had to do a book review and do a lecture on that we have as human beings now a choice between living and being instructed by algorithms. We are using a Zoom connection right now. I'm using my iPad to talk to you. I'm using it very consciously. It's a tool in my hands. It is not my master. The minute we allow a slippage in our consciousness, where we start saying living in artificial intelligence, we've already started to say artificial intelligence decides what instructions will be given to us. I sent you all the campaign we've started today to protect our biodiversity by how we eat and how we know how we eat and how to prevent the data piracy and the biopiracy. But in that project, at the bottom of it, of this data harvesting and data capture is, and then on the basis of this, do behavior modification. If good food in Kerala is good for Kerala, if good Mandua Jangora is good for Garhwal, if good Jwar Bajri is good for Rajasthan, isn't the best way to conserve biodiversity and health is to allow better knowledge of Ayurveda, better knowledge of public health, more gardens everywhere? That would be the approach. That would be living intelligence. Behavior modification is what artificial intelligence instructions do. There's a brilliant book I would suggest you all to read. It's written by a Harvard professor, Susanna Zuboff. It's called Surveillance Capitalism. And she's done this book over 20 years. She's actually spent time with the companies who are designing all this. And the top element of it is, see, all exploitation. I think it was Dr. Gangadharan who talked about, this, and Sundarlal always talked about this. Dohan versus Soshan, Dohan is you take the gifts with gratitude and with asking for forgiveness. And Soshan is you just take what you can. I call it extractive. So when you destroy the forest through extraction, that's what the Chipko movement was about. You basically destroy the water, you destroy the streams, you leave the disasters. And that is Soshan. And that reduces biodiversity to raw material and raw resource to be extracted. So in art, so-called art, I don't like the word, I call it machine learning and algorithms. Basically, they're taking what analysis is coming out of our data, out of our exchange. I can tell you the Googles and all are busy trying to exchange what we are talking about. And it's all working very, very hard. You will see how quickly they autocorrect your words. Every time I write a Hindi word, it's autocorrected to be something else. When I write super pests created by GMOs, it becomes super seeds. It's brilliant, the algorithm censorship that goes on. But now, where's the data coming from for behavior modification? It'll come from harvesting the data of biodiversity and our knowledge. And then behavior modification as the algorithm manipulation of our minds through messaging to say, this is wrong. I showed you this book. How many of you have stood behind a cow and does it stink? Methane is the stink. The concentrated animal farm operations of America stink. They pollute the water, they pollute the air. The 4 stomachs of the cow is what this brilliant man says in its methane, not the diet that the cow wasn't supposed to have. And then they've done algorithms to convince enough people that the problem is the animal, not how you treat the animal. That is why let's stop using the word artificial intelligence. That living intelligence, there's compassionate intelligence, there's cooperative intelligence, there's emotional intelligence. All these intelligence are the ability through consciousness to choose. Inter legre. How do you choose? How do you make choices? Algorithm says, stop making choices, stop making your consciousness, follow the instructions, behave, modify your behavior. Usually in our times, modify your behavior for a market for fake food, a market for extreme diet, a market for all kinds of things. So let's not get into adopting the language that doesn't give the clarity. Let's use accurate description that is scientific, that describes what's happening. It's machine learning and algorithms.
May I add a bit here?
Yeah, please.
Well, one of the things that we must recognize is that all these so-called predictive algorithms are essentially based on data sets which are defined on information gathered in a particular context. And we know from Bayesian analytics, the context matters a lot. The prior probability as well as the observed result together determine what the post-test probability is, the posterior probability. So any of this is very much context dependent. Most of the algorithms that have been developed and foisted on us have been developed in a different context, and they do not necessarily apply to us. We therefore need to contextualize it very much to the social demographic features of our population groups, as well as the individual features of the individual, which is what Ayurveda says too. So that is where I believe most of the algorithms that are currently available, for example, in the area of health or elsewhere, which have been developed in the West, are contextually mismatched to us and do not necessarily serve our purpose. So to be dependent in a world on artificial intelligence that has been gathered elsewhere and directed at us would be actually committing the folly of letting our lives be guided by different data sets which are not representative of our population groups or of our individual characteristics.
Thank you, sir. One more question connected to Dr. Reddy, and that is actually the current status of actually the policy formulation, where One Health approach is actually taken up by the government after the pandemic. But is it inclusive of the all kinds of practices which is going on in India, or we just follow the the Western concept of One Health?
Well, I think One Health has come up now as a reaction to the pandemic. I don't think it has been conceptualized well enough, though there was a basic recommendation in the programmatic platform that was prepared by the World Health Organization. And even in India, a fairly broad-based One Health approach was advocated. But right now, I believe the government of India's plan is really looking at partnerships between the health agencies and agricultural universities for veterinary studies, and not really venturing deep into the whole area of connecting wildlife, forestry, veterinary population, and human health, apart from the interdisciplinarity that is required or the multidisciplinarity that is required which has been spoken of in the last presentation. So I think we do require a much broader approach to One Health rather than, again, a mechanistic linkage only between certain animal forms and certain human diseases.
So, don't you think that this needs some kind of a grassroots level discussion as well before going into or putting it into practice?
Yes, absolutely. I fully agree. Because again, these are complex systems. You can't have linear approaches. So that is where I believe we must have a broader discussion and bring in multiple disciplines into it and see how we can actually pool our knowledge in a manner that will actually benefit a better understanding as well as a better formulated response.
Yeah, thank you, Professor Reddy. And question to Dr. Gigi is that, nowhere in the national discussions on One Health and also in the restoration, the health restoration discussions, the Ayurveda and Indian system medicines actually, is projected well. And where is actually the gap, particularly in policy making exercise at the top level?
Yeah, I do. I think we still work in silos. There are no interdepartmental discussions when health comes. I have told this to Secretary also that Ayush systems are not many times invited when you take kind of these discussions. There is a need for interlinking the departments, especially women and child development. They have been doing some program on health. Ayush has been doing something. And health as a mainstream has taken up this issue. So there is no inter-departmental discussions. I think there is a need. It has happened not only now. If you take the 1980 first time health policy came, first document on permanent health policy, in that there is only one line about Ayush system, Ayurveda. What it says that when the primary health centers, when the vaccination is being organized, let us use the Ayush resource people to arrange the people in right kind of queue and make sure that they get this is the kind of, and it is written document. That is the first time I went to the field. I felt myself ashamed. This is what we want to use Ayush. I'm making people to arrange, and they never wanted the knowledge or practices to be incorporated. Even now, what is happening in the COVID, even the mainstream Ayurveda is completely neglected. Ayurvedic resource people are used in the COVID hospitals for duty and other things, not as to use their science. So this is happening in the last 60 years. This is what is to be questioned. And they do not allow how the knowledge being created by Ayush is not in the paradigm of their reductionistic science. That's as simple as that. So I do agree that there is no much this thing. And I also told about last time, my book is getting published on Penguin. I have told that even today, you see the last budget also, the total allotment of Ayush, 2000 or something, it is lesser than All India for Medical Science for 1 year budget is what is given to Ayush for the whole system. This is happening from last 50 years. It's not a new thing. And the total budget of 70,000 crores, something 2% is the Ayush department's allocate. So how can you expect any kind of interaction in this thing and all those things? It is not there.
Yeah, one more question.
Biju, may I just interrupt? My battery is running out. Yeah, so if I disappear, suddenly it will not be because I disappeared, but my machine threw me out.
Okay, right. Yeah. In that case, can you have, there is one question, directly to you, and that is regarding the, you set the priorities. In this post-pandemic, how do we prioritize the priorities for biodiversity conservation, particularly in the context of, putting the natural capital on top? All the CBD discussions, unfortunately, is concentrated on ABS only, where there is a strong market force linked with that. Otherwise, there is not much discussion on the natural capital and how we can revive it in a holistic manner.
Well, I began talking about the difference between economia as art of living and crematistic art of money making. And that's really the clash of civilizations now. All the presentation showed how money making led to invasions of forests, led to emergence of new infectious diseases, We were already vulnerable in our bodies because of the money making for the junk food industry. It all adds up. Yeah, that we are living through a build-up of the residues of a greed economy. And it has devastated biodiversity, devastated the climate, and devastated our health. And with the lockdown, devastated livelihoods. No one is keeping track of that. I mean, we lived through it. I mean, I know everything just disappeared, but look at the people around us for, 3 months last year, 1 month there, nothing, no livelihood. Most people in India are daily wages. So what I would say today is it's vital to regenerate biodiversity by linking it to options for living and livelihood, including in urban areas. If I had to design, I would say, let there be gardens everywhere. Let all farms go organic. Let all the people are doing kitchens, community kitchens to get food to the sick because there's no food. Shouldn't that become part of a model of our economy? That we have community kitchens, we have livelihoods in kitchens. Why don't we use the experience of COVID to say, this is what works when you live through catastrophe. We are living through collapse. Let us make the caring economy the center stage of how we rebuild. A movement from greed to care.
Thank you. Thank you, Vandana ji. That was a good message. And the question directed to Dr. Shalini is that, see, there are very good, you have also highlighted very good models where the local economy gets support from the nature-based solutions. But if you look at the practices, including in Africa, what is happening is that even the nature-based solution concept is taken up by the corporates, especially when you have a knowledge-poor society. Always this is taken up by the corporates. And do you think that will happen in India as well?
Thank you so much for this question. I think that's a very, very important question right now when we talk about nature-based solution. I think it's just repackaging of something that was already available. And now when we also work with corporates, we see that they really want to build up on this concept because this is internationally selling very nicely. But I think the inherent component of linking it to livelihood, local people is something, if that can be ensured, that can be implemented and practiced, I think it's nothing bad in using it and further scaling up. And the better approach is, the benefit of this approach is that it can be not limited to one geographical area or one ecosystem or one landscape. So right from a rural area to urban area, it has a lot of scaling up benefits. So in that case, I think it is well to go with the concept, but at the same time, in your own efforts, how nature-based solution can look like in your particular area. Because the most important aspect of this approach is one t-shirt cannot fit all. Something that you are implementing in Kerala for disaster risk reduction and landslide reduction might not be very suitable for Himalayas. Something that is very good for central India might not be very good for Bhitarkanika. So that kind of understanding needs to know that still local people will be the main knowledge holders, the contributors to this approach. So that is what key is. Even if corporates take this concept, they can only display it in the meetings and presentations. So actual implementation cannot be fulfilled, cannot be implemented without understanding of local requirements, local context, and how benefit they can get while their own knowledge is included in it.
Yeah, thank you. Basically, another question that can be answered by anybody, and that's a general question. That's actually why despite several inputs from the activists, as well as including Sundarlal ji, for the last 50 years, continuous struggle for incorporating the whole kind of ecological thinking into policy making. Why do we fail repeatedly? Why this kind of the interventions are not reaching the top? Vandana?
Yeah. So if you look at the years of Chipko, the biggest lobby in UP elections used to be the forest lobby. And in spite of that, Chipko managed by 1981 to get a logging ban. Yeah, it was actually banned. Logging was banned in the high altitudes. But 90s onwards is the neoliberal globalization. Yeah, greed is good. no limits, deregulate, remove and dilute the environmental laws, remove and dilute local governance structures, which is why you see, on the one hand, huge deforestation. On the other hand, a total change in our agriculture systems, which is led to the farmers' crisis, which they're on the streets right now. So what changed really was deregulation. And we are moving into a new system. And that's why when I say clash of civilization, Shalini gave a brilliant presentation, but I read rubbish from Bill Gates. I read rubbish from the World Economic Forum, who talk about turning this into the next opportunity. You will own nothing, you'll rent everything from us. If you rent, you have to pay. If you pay, you'll be in debt. Chemicals got us into debt, GMOs got us into debt, the Vidarbha crisis and BT cotton crisis. And now if you have to constantly buy data to do anything you want to do, my Gmail has shut down because Google just decided they've got to increase the rates. And every year, they'll keep escalating these prices. How long can you pay for living? If water is not from the springs and is all from Coca-Cola, 12 rupees a bottle, how many people can afford it? That is why we have to shift to ecological systems as economy. That's where Sundarlal Bahuguna comes in. And this means the deregulation. The corporations are working on very rapid deregulation. A lot of time, public-public partnership means knock down the laws. I get very surprised that in the Sustainable Development Goals, the Convention on Biological Diversity is not even mentioned. Protecting biodiversity on the land doesn't have a treaty. Climate does. The biodiversity treaty isn't there. I attend so many meetings. I have to constantly remind people, but there is a law. And laws need respect. And living systems, and I think Dr. Reddy will agree with me, all living systems need regulation. That is what creates the metabolic order. And you get rid of metabolic orders, you're going to get collapse. And that's what we have to challenge. That's what the new generation has to challenge, because now it's not a loss of a forest here, loss of a forest there. It is really a threat to the very existence. It's basically species extinction as a threat. And we are living through one element of it through COVID, but it could be much more and much worse. Can you imagine the villages in the coast, western coast of India? They've lived through COVID and they've lived through Tote. What life is like, that is the future if we don't make big changes. And in a way, we need a Chipko everywhere. To the young people who are attending, do a Chipko wherever you are, with whatever you love, with whatever biodiversity you care for. Just do the Chipko.
Thank you. That is a good note to end this webinar. And let me all thank all the speakers for a wonderful morning session, and a lot of points to discuss and carry the ideas forward. And definitely what we need now is rather than a centralized approach, we need more and more Chipko, as Vandana ji said, in different parts of India. And there should be actually local leaders, especially the youngsters, to carry this message forward, so that ultimately we will succeed in preserving our own soil, our own health, and our own planet. And that is a message which we can take up from this webinar. And we are on time. And I also thank all the speakers, Dr. Vandana ji, Professor Srinath Reddy, Dr. G.G. Gangadharan, and Dr. Shalini, for keeping up to the time so that we can finish it on time. Thank you all. Thank you so much.
Thank you. Thank you.
Thank you.
And